What are the results from long-term exposure to antipsychotics for people who continue on the drugs as well as those who go off the drugs?
So antipsychotics are drugs that that were first used for people who are diagnosed with schizophrenia and psychosis and are now much more widely used. And they do have some really serious effects if you take them for a long period of time. They cause a neurological condition called tardive dyskinesia. There's evidence that they shrink the brain volume, brain size, and they cause weight gain, diabetes, heart disease, sudden cardiac death. They're very unpleasant to take. They cause sexual dysfunction in most people who take them. So there are lots of serious consequences from taking them for a long time. If you stop them, and if you stop them suddenly, there's a withdrawal syndrome. There's sedative drugs, so when you come off them, they might make you a bit agitated or stop you sleeping. But there's also evidence that in some people, they might actually, people who already have had a diagnosis of psychosis or schizophrenia, they might increase the risk of getting another episode. And there is also evidence from some case studies that people who have never had an episode of psychosis might get an episode of psychosis if they're on these drugs or similar drugs and come off them suddenly. That evidence comes from drugs that are similar to antipsychotics that are used as anti-sickness drugs. And as I said, there are a few case studies that when people have stopped those drugs suddenly, they've had a psychotic episode and they have no history of having one in the past. So taking them long term has lots of consequences because they are drugs with serious adverse effects, and coming off them, especially coming off them quickly, can be risky, as it is for many drugs.
Dr. Joanna, isn't it true that the studies are usually done for months or very short periods and not years, so that the long-term results frequently aren't known or reported?
Yes, so the studies that have looked at long-term treatment, and long-term treatment is the standard treatment for people who have psychosis or schizophrenia diagnosis or a bipolar diagnosis, which is an increasing number of the population. And that treatment is based on these studies that have compared people who are already on medication and randomized to people who've been taken off. And they've randomized the two groups. So one group are randomized to carry on the medication, the other group are randomized to be taken off and put on a placebo. And then, as you say, the follow-up is usually quite short, and what you find, surprisingly enough, is that, or unsurprisingly enough, is that the people who are taken off the medication have higher rates of problems than the people who continue on the medication. But there's some evidence, and one particular trial that's been done in the Netherlands that followed people up for 7 years, and that found that actually in the long term, people who'd come off the drug, and in this case they'd done it gradually, or some of them hadn't even come off, but they'd reduced gradually. And this study found that those people were actually doing better than people who'd stayed on the medication long term.
Can I just make a corollary to that? When you think about antipsychotics, though, and these are probably among the most controversial drugs that we're using today, certainly the most powerful. Right now, in America, they're using antipsychotics largely in older people in long-term care facilities. These drugs are used as sedatives to calm down people who are agitated, maybe because they're super cold, their soup is cold, or they're otherwise not being well treated in a long-term care facility. You've got probably 20 to 30% of elderly people in long-term care on antipsychotics. And you look at this and you say, really? What is going on there? These drugs are contraindicated in people with dementia, which is to say that if you're an elderly person and you have some level of dementia, the drug is likely to increase your risk of death as opposed to getting something else. This is really an amazing fact that we allow this to go on, that antipsychotics are used to basically turn our older people into zombies. It's not just the elderly, though. The drugs are used in children, in people with very mild forms of depression, what is defined as a treatment-resistant depression, if you're, which is a definition by the pharmaceutical industry, in my opinion. You are depressed, you get an antidepressant drug, it doesn't seem to work, and then they move you up to an antipsychotic. And that is really just the beginning of some serious problems, as Joanna's described.
Shall I just describe the drug company's role in that? So in the 1990s, various pharmaceutical companies realized that there was this huge market for antidepressant drugs, and they had these new expensive antipsychotics that were going to go off patent, and they decided that they wanted to capture the market for antidepressants. So they started to present their drugs as treatments for complex mood disorder, bipolar disorder in a form that was massively expanded, and for treatment-resistant depression.